Welcome to Microbiome Minutes. My name is Whitney Kell. I'm a certified coach, and it's an honor and privilege to have gut health expert Kiran Krishnan with me today. He has over 15 years of research and development in molecular medicine and microbiology. As a matter of fact, he's already done 50 lectures in the last 12 months to health professionals to train and coach them on how to utilize and how to use gut health in their practice. In addition to over 13 clinical trials going on around the country, Kiran is an absolute master at this topic, and you're about to find out how masterful he is. This particular topic is for our moms today. You know, I have some friends around me that have been pregnant, and many of them get sick a lot. And I remember, Kiran, when we were talking about that, you had so much wisdom to share. Would you share what's your take on that, and how is the gut health of the mom related to the gut health of the baby, and how does it affect their hormones after they deliver?
Sure. Yeah. So really, really important topic. Of course, if women aren't successfully having babies, then there goes their species, right? So we want to make sure moms have the best chance of having healthy pregnancies and healthy babies. So a baby is essentially, and I hate to use this word, but I can't think of a better word, but essentially a parasite on the body, right? It's there on its own. It's not doing anything for itself, but mom is dependent or it's dependent on mom 100% to provide it with everything, with nutrients, with immune protection, with all of the metabolites, all of the biochemistry that's important for the baby to grow. And as a baby goes from a teeny tiny microscopic cell into a fully formed human, it requires a lot of energy to do that. And as it's going through that process, it requires a lot of immune protection. So the mom is now working for two. And so her system gets stressed. You know, her immune system gets stressed, her digestive system gets stressed, her physical system gets stressed, as we know. It can be very uncomfortable and so on. So because she's going through that additional stress in her immune system and her digestive system, she needs additional support through the microbiome, because so much of the immune control in the gut is put upon the microbiome. So imagine 80% of your immune tissue in your body is in your digestive tract, right? It's somewhere in your intestinal lining. And all of that immune tissue is covered by bacteria. So the bacteria in your gut dictate how your immune system functions and responds. And when mom has this extra stress on her system to protect this growing child, she needs extra support in the immune side in the gut lining as well. So if her diet is changing, her mood is changing, her environment is changing, so the bacteria within her gut are fluctuating, then her immune system can become suppressed and she can become more susceptible to getting sick. The body is so intelligent where it will sacrifice mom's ability to defend against a virus or bacteria over putting extra protection on the baby. You know, so if the overall system is getting stressed, then mom is going to suffer more of that outcome than the baby will. You know, so managing the gut and making sure the microbiome is healthy and diverse is going to be really important for mom to maintain the functionality of her immune system and reduce her risk of getting illness.
And then, Kiran, I was very curious because I've known some moms who get postpartum after having the baby. Can you talk a little bit on that?
Sure, yeah. Hormone balance is a huge issue with pregnancy, and we call it the fourth trimester. You know, there's a great book by Dr. Jolene Brighton that talks about that, and then also the recovery from things like long-term use of birth control, which also can have similar effects because we've been skewing the hormones in one direction. And then if your body can't bounce back and rebalance the hormones, it causes an imbalance that can drive emotional distress, physical distress, immune dysfunction, and so on. So as a baby is sitting there in utero, it's actually demanding high levels of certain types of hormones. And again, mom's digestive tract goes under stress. Now, when the baby is born, that's a huge change to mom's immune system, and there's a huge flush of hormones that come out after the baby's born. Now, mom has to rebalance her system to go back to her normal homeostatic hormonal balance. Now, the gut plays a huge role in balancing hormones. Number one, the gut produces virtually every hormone that our endocrine system produces. Estrogen, testosterone, serotonin, dopamine, all of these things, especially those happy hormones, 90% of them are produced actually in the gut. And when mom delivers a baby and she's her body's going through a lot of stress because she's nursing. The caloric demands are changing. The immune system is going through a lot of stress because of that. We need to make sure that mom's gut is supported in a really effective way so that it can metabolize and produce the right hormones for her. So a lot of times what occurs after pregnancy is mom's gut microbiome gets suppressed because of all the other stresses in her life and her body. There's nothing more stressful than having a new baby, which I think a lot of people can relate to. That kind of stress increases leaky gut. It can disrupt hormone function in the endocrine system and in the microbiome. And all of that can throw her into a spiral of having a dysfunctional hormonal response. And again, a lot of that can be fixed just by going in with the right kind of probiotics, prebiotics, mom trying to expand some of her dietary diversity in her food to maintain that balance in the microbiome.
So just in closing, and that was fantastic to assist moms in preparing their gut health. How about the baby? Is there a specific dose? I mean, would you recommend they go back to their doctor and they work with them on what dose of probiotics or what types? Or is this something that you can't really get endangered by because probiotics are just bacteria that we all have in our gut, and adding more just actually balances it? What would you say about the baby?
Yeah, so in fact, if your baby is vaginal birth, so it's a regular birth without a C-section, so the baby's vaginal birth and the baby's nursing well, for the most part, a baby doesn't need a probiotic early on in life because mom's milk has 600 to 800 different species of bacteria in it. Mom's milk is loaded with really important probiotics for the baby. And then mom's milk is also loaded with over 200 different types of prebiotics that the baby can't even digest for energy. It's there purely to seed and feed the bacteria the baby's getting from mom. So assuming the baby was vaginal born and is nursing really well and mom is relatively healthy, you wouldn't need to consider a probiotic for the baby unless the baby has very specific conditions. So if the baby has excessive diaper rash, is spitting up a lot and is not really digesting mother's milk very well, has rashes, gets a lot of eczema early on, is showing signs of allergies, then those are, or the baby has been exposed to a round of antibiotics early on in life, which can happen as well. In those cases, you'd want to utilize a probiotic. There are kid-specific probiotics. The most important strains for babies are bifidobacteria. So if you can find a bifidobacteria-based probiotic or a spore-based probiotic, those will help baby a lot. And just follow the directions on the bottles. They're all designed to be perfectly safe for baby. You could talk to the pediatrician, but a lot of pediatricians just don't know enough about probiotics to really give advice, but again, if the baby's healthy, if it's a vaginal birth, if there's nursing well, you wouldn't need to consider a probiotic till at least 1 year of life. And for mom, now assuming the baby is C-section, and is not nursing well, then you would want to consider, like we talked about. Mom should always look at doing a probiotic after birth, especially because her system, her immune system, her digestive system is going through so much. That's a very, very taxing process. And then just the breastfeeding alone is so taxing from an increase in caloric demand and so on. And her immune system has to work overtime to produce all these immunoglobulins that are sent to the baby through mother's milk. Right? So her immune system is going through a lot of stress as well. Probiotics can be a huge help for mom, especially after birth.
Fantastic. Thank you. And I know a lot of moms that will benefit from this information. It sounds like really probiotics are modeling mom's milk. It all goes back to nature of what we need and how our bodies respond to that. So that's exciting. Thank you. If you want to, for those of you watching, want to join us for the next Microbiome Minute, we've got some exciting things coming up with Kiran Krishnan. Thank you so much for sharing your wisdom. It's
my pleasure.
Thank you.